I think we're just on the cusp of what we understand. And so the brain, while we understand it partially, and there are definitely ways that we can manipulate it and move it forward toward recovery, um, the way that it really works is still a mystery. It's beyond our understanding, but yet still we can work with it, and we know things that do work to try to restore their function.
This is a revolution to fight for truth, to fight for the people who trust us with their health, and to fight for research-backed action. This is a fight to purge baseless trends and customs in healthcare. This is a revolution to change the steps of healthcare from reactive medicine to preemptive medicine. Our vision is to be the catalyst for a system of proactive healthcare versus reactive healthcare. This is Impetus Health. All right, hey guys, welcome to Impetus Health. I am Sean Hill and this is my wife, Ellie Hiller, and we have a very special guest today, Dr. Dennis Fell. Dr. Fell is a medical doctor. He's an MD and a physical therapist. His background is he's a physician resident in pediatrics for quite a long time, highly focused career on neurology and neurological rehabilitation. He is the former chair of physical therapy at the University of South Alabama. Go Jags, that is my school as well. He is the editor of Lifespan Neurorehabilitation, a patient-centered approach from examination to intervention and outcomes that focus on evidence-based approach to the neurological rehabilitation of adult and pediatric patients across the lifespan. Ooh, I got it out. It's a textbook, and I believe they're using that book right now at South. Is that correct?
Correct.
Awesome.
It's being used in about 70 programs across the U.S.
Wow. That is amazing. Yes. And it's so cool to see your name on that. But anyways, and vice president of the APTA Academy of Neurologic Physical Therapy, professor emeritus and professor of neurology. And he was the chair when I was there, my chair and my professor, Dr. Dennis Fell. Thank you for being on the show.
It's my pleasure for sure.
I'm very excited about doing this. I was telling Ellie, when we were in school, we had some awesome teachers, some incredible teachers, but Dr. Fell was always special when you got into Dr. Fell's neuro class, because there were some really hard topics, and things like the basal ganglia, besides being in my brain, are seared into my brain because there was so much on that. But I remember, and it was fascinating. I mean, I sat in the front row, and we would all ask you so many questions, but we had this running thing where we were trying to stump Dr. Fell with a question about the brain, and nobody could do it. I don't think we ever did it. You always had a great answer to it. And it was a blast learning from you, because you were so knowledgeable on anything we asked. And it was a lot of times people ask me a question and I'm so stumped, but you never seem to get stumped. So I appreciate that.
Maybe I'm good at hiding it, or find an answer later and then bring it back.
Well, maybe, yeah. And you would do that too. So you would answer, I remember that you would answer it then, and then you would like write it down or eidetic memory, I don't know. But then the next class you would bring it back up and say, hey, I want to elaborate more on this. But it was always very impressive. But Dr. Fell, I mean, you just incredible career in neurology and the study of how the mind moves and how movement goes with the brain and all the different intricacies that fall into that. And that's what we're going to talk about today for those of you guys listening. And there's so many ways we could go with this, but I really want to focus on just to letting people know what how powerful is the brain, what can the brain do from a movement perspective, and we're going to get into some of the questions. So I guess you're super accomplished in this space in education and healthcare, but give us a little bit of your background and what has been the driving force for you all these years in healthcare and in the neuro field.
Well, I guess if I go back all the way to the beginning, I'm one of 6 kids. And I was right in the middle of the pack, or as close as you could get to the middle of 6. And I figured out pretty early that I had to do something to make myself stand out and kind of make my way. And, God gave me an ability to learn and a love for learning. And so I just tapped into that and went with it, and, did well in school and high school and then in college. And that's when I did go to medical school, even though I don't practice as a physician now, I have the medical degree, and then just felt to do something that was more focused on directly helping people through a process, not just diagnosis and medical treatment, but that's what drove me. My wife Noelle was a PT at the time, and I saw the real quality of patient contact that she had, and fell in love with that aspect of really being connected with your patients. And so that kind of just propelled me into that healthcare arena, first in medicine and then switching over to physical therapy, because of that amazing connection that we have as PTs with our patients, to be able to spend quality time over and over again while they're going through this rehab process, knowing that one day they're going to leave us.
Yeah.
But that's our goal, is to get them back to an independent point where they don't need us anymore. And I guess the other thing that has kind of driven me to learn and be the best that I can, and admit when I can't answer a question, but then go and find the answer, as we were talking about, is that I've discovered the best way to really learn something in depth is to teach it.
Yes, sir.
Very true.
Just teaching students and hearing the questions that you guys came up with, that just drives me to a deeper level. And sometimes a student will say something, and it's like something clicks in my brain that, like, oh, that's how that fits with this. So my family has been a hugely supportive force through that process, and then the way God equipped me to learn and to enjoy learning. So
love it.
Amen.
And I'm still learning every day. I consider myself a lifelong learner, which is one of the reasons I'm part of the APTA, is to continue my understanding and grow in knowledge.
Yeah.
I love that.
That's an incredible characteristic to have, to continue to want to learn. It's awesome. Very admirable. I couldn't help but remember so many things that we apply in the neurological field, and we're going to touch on this in a second too. I remember we went over PNF. You talked a whole lot about proprioceptive neuromuscular facilitation. And I remember as I was going through this, and I was always looking through everything from a strength conditioning lens, and all of a sudden we get into PNF, and I'm seeing all these things that you do with a quote unquote neuro patient. We do the same things with a strength conditioning client. It's the same concepts. And you put me on a lot of the techniques that I use with lifters or another quote unquote an athlete in the gym. All of those same concepts all come back to neuro. And that was so cool. Like, for instance, I think you might remember this, but I wrote a paper on RNT, reactive neuromuscular training, which is a branch of PNF. And that's something so commonly used. So it's cool to see all this connected, and I'm jumping ahead. I'm so excited. But so you were my neurology professor, and you have spent most of your career in the field of neurology, from teaching it, writing research papers and books. Why neurology? Why did you decide to put your efforts toward the brain and toward that field?
So I started off initially in pediatrics, but then so much of pediatrics is really neurology. There are orthopedic things, but a lot of it, and the part that I really gravitated toward. And then just over my career and at the end of PT school, gradually shifted more toward neurology in adults, and just a fascination with the brain. The brain is truly amazing. The capability that it has inherent within it, the way it's created, the way it's made.
Yeah.
The fact, when I look at it from an embryology standpoint and see that every human being, regardless of race or background or what country they're from or any other cultural thing, the sequence of embryology of the brain happens on basically the same timetable, and it's very carefully regulated by the way our DNA is made and guides that process of development. So I've just always been fascinated with the way it works. And then when I started to work with patients who had neurologic deficits from a variety of diseases or traumatic events, it just drew me in even more, because I would see things that when you see it, it's almost like did that really just happen? How did that happen? And then you go back and think about it, and then to finally have the realization that we as PTs and OTs, we can actually impact that. We can change it through the experience that we provide the patients and getting them to do repetitive activity and practice of the things that we want them to get better at. Motor learning happens, and in that motor learning, their motor control improves. And so you see an improvement in their ability to control movement, which then translates into their improvement in functional skills and independence in their function.
Yeah.
So the bottom line is that we, as humanity, over the past centuries, we have learned and understand so much about the brain. And yet at the same time, we still have so much that we don't understand about the brain. There's still so much untapped knowledge about how we might be able to change it. And you and I have talked before about, BDNF, and that was not even a topic, 10, 15 years ago among PTs. But when that research came out that showed that this brain-derived neurotrophic factor, it's a chemical that our bodies actually produce. Some people genetically produce more of it than others, but it's a chemical that is neuroprotective, but it also makes it much more likely that a brain is going to reorganize and change and have neuroplastic development after the person has gone through some event, some neurotraumatic event.
Yeah.
So, I think we're just on the cusp of what we understand. And so the brain, while we understand it partially, and there are definitely ways that we can manipulate it and move it forward toward recovery, the way that it really works is still a mystery. It's beyond our understanding, but yet still we can work with it, and we know things that do work to try to restore their function. So I'm hooked. I'm a nerd from way back, and especially when it comes to brains and the way they work.
That's fascinating. Just to kind of piggyback off some of the things you said about the brain, now that I have, the ears of someone who knows so much about the brain, I want to throw a question out there and tell me if it doesn't make any sense. But Sean and I, as you know, are very in the strength and conditioning world, food, nutrition, all of that. So when it comes to the brain, as you mentioned, neuroprotective, I guess I interpreted that as kind of like the brain can tell us, when we're in pain, it can tell us if something's hot, like take your hand off the stove, right? When it comes to like fitness, let's say, and exercise, at what point, when you're like kind of pushing past that level of pain or discomfort in exercise, at what point are we getting into a territory of we don't need to keep pushing away these signals that the brain's telling us of, like, you might be overheated or you might be in too much pain, you're pushing too hard? Like, from your standpoint, from a neurology standpoint, at what point do we even have control over suppressing those signals, or does it become unsafe? Does that make any sense?
Sure. Yeah. I think for somebody who's new in that area of aerobic exercise and really pushing the body to perform, I think probably the most important thing is to not start at number 10 at the very beginning. You start somewhere at the beginning and you gradually work up to that point.
Right.
Your body speaks to you as you go through that process, and that's your brain working again.
Yeah.
It's monitoring, all of the chemical reactions that happen in muscles as we act. And so it's monitoring lactic acid, and it's keeping a gauge of that. And if something's going wrong, if you're pushing too hard, it's going to tell you. And so then we react to that and we say, okay, I'm not going to push as hard for a little while, but I probably will be able to push harder again after I build myself up to that level. So again, the brain is an important part of that. And just being aware of that and having that self-awareness and paying attention when your body gives you those signals to say, okay, maybe this is the level that I need to stick at for a while until this becomes comfortable, and then I'm going to push myself forward. It's exactly the same principle that we look at when we're looking at progression of exercise and activity in patients with stroke or head injury. You know, we want them to work at that highest intensity possible. There's a ton of new research, and one of the latest clinical practice guidelines that have come out from the APTA, Academy of Neurology, is on the importance of intensity in functional training. And so, you know, that's been around with sports for a long time. But now the evidence is very clear that even in my patients with stroke and head injury and kids with cerebral palsy, that working at that high intense level is what's going to bring about those neuroplastic changes. And BDNF that I mentioned a while ago is definitely known to increase in circulating concentration in individuals immediately after exercise. And if somebody does exercise regularly, their baseline level of BDNF rises. And especially if they have the genetic coding that makes them a person that is easier or more natural to produce BDNF.
Can y'all remind me what BDNF is again?
Brain-derived neurotrophic factor.
Okay.
So it's a neuroprotein that is produced, our cells actually produce it.
Oh, wow.
And the cool thing about being BDNF is when you mention the high intensity, like we look at BDNF, and especially in the neurological realm, when someone's had stroke or TBI or they're trying to return to movements that they did before. And it's such an important role in relearning movement. Like you heighten the BDNF, you're able to relearn movement at a faster pace if it was lower. Well, the same thing with the safety mechanisms. BDNF plays a role, and where is that safe zone? Where is my safe zone? And is it, you know, talking about endurance athletes shutting down those safeties to surpass it, and then you have heat strokes and things of this nature occur. The high intensity thing is something that is so huge, and I want to touch on this a little bit when we're relearning movements. The brain, and I definitely want to see what you think about this as far as that. We're going to talk about that 6-month window. So I'll go ahead and jump into that and phrase it in that phase. But so after you have a traumatic brain injury, a stroke, something occurs, what we tend to hear is that you have that 6-month window of, I guess, hyperneuroplasticity. Would that be a good term for that, when you have the increased ability to relearn things from speech to movement to every different aspect? On that 6-month one, is that still, and you're much more closer to this stuff than I am, is that still accurate to say we have about 6 months of increased neuroplasticity before it starts to plateau out after that?
I think the word that you use that's key there is increased. So the greatest amount of recovery, the greatest rate of recovery is going to happen in that first 6 months. But that doesn't mean that all of it's going to occur in the first 6 months. That's just when it's happening the fastest. And so, you know, I guess the studies that come to mind in that regard are like all the constraint-induced movement studies. When they did constraint-induced movement trials, all of those early trials were using people that were at least a year after their stroke. They only used chronic stroke. And with that very intense activity mode that they have, focusing on repetitive use and practice and feedback with the affected side, those people, even years, you know, some of them even 5 years after their stroke, showed significant improvements according to the metrics that they were using to examine their motor control. And so, yes, the first 6 months is important, but I always make sure that my patients know not to discount expecting improvement. It's just not going to be as fast after that first 6 months. But if you do something that's really intense like that, and that brings me to the point that it's not just about what I do with the patient in the clinic, but it's about what I do with them in the clinic. And then I'm only with them maybe at the most an hour in a day.
What are they doing
And
at home?
maybe they're sleeping 8 hours. So what's going on those other hours?
Mm-hmm.
If they're not practicing the same things at home and doing things in an intense but safe way at home, then what I'm doing in the clinic is not going to be as effective.
And that's something. Sorry, go ahead. Sorry.
So I just really always remind my patients to be sure that you are doing these kinds of things at home,
Mm-hmm.
and make sure they understand that without that home practice, without those repetitions during the other 10 hours that they're awake, if they're not doing something during that time, they're really missing out on an opportunity to prime their BDNF pump, if you will.
Mm-hmm. Yeah. I love that. And that's something I wanted to have you elaborate on, let you elaborate on a little bit, because I have so many patients through the clinic. We've been blessed to see a lot of patients who are dealing with these same issues. And some of these patients have had it burned in their head. You have 6 months. And it's just not true. We see incredible progress after that. Yes, your neuroplasticity is heightened, but because we can manipulate learning, we can manipulate from an intensity perspective, from the environment we place you in, manipulating that environment to make you as adaptive as possible. We see some incredible things long time after that 6 month window has quote unquote closed. And I think it has to do a lot with that progressive overload. How do we progressively overload you? Are we adding in aerobic capacity work? It's going to increase those hormones to give us, it ends up turning into, this is where it's so cool to me, it turns into strength conditioning. The same thing you would take someone through if they're trying to add 10 pounds to a back squat or to a deadlift, or maybe I'm a cyclist and I'm trying to PR my marathon time, or whatever we're trying to do. Like, it ends up being very similar concepts. We're able to apply those. We find the weaknesses, what's weak, what are the movements that we're not good with. For instance, I have a client, he would not mind me saying this at all. He's incredible. We actually had him on a previous episode. The Bull Didn't Win. If anyone wants to listen to that, it's a great podcast. But when we first started, I tested, his whole thing was he wanted to be able to play in the backyard with his brother had just had a child. He would be able to play in the backyard with the kid when he got a little older. So we worked on certain things like a 40-yard dash. What is your 40-yard dash time? So we tested it. And when he first started, he could not run 3 or 4 steps without falling over. And I would literally tell him, I want you to do it anyways, and I'm just going to catch you. So we would do stuff like that. But now and that was month 1, it didn't take us till about 3 months later that he tested that 40-yard dash, and he's able to do it. He was able to run a full 40-yard dash in a pretty good sprint, and working on things that really challenge him. I think, and you talked about that, it's the challenge. How much can we actually challenge you where we're getting the movement we want, and you're seeing that relearning process occur. So just want to encourage anybody who's listening, like, 6 months is, we want to do as much as we can in that 6 month window, but after that, there's still so much hope. There's still so much that we can do at that point. So I just wanted to bring that up and talk about that. I love that.
Sure.
Yeah. So the reason that we have this whole podcast in the first place is because we wanted to talk about bring healthcare into the forefront. But our big thing is that we want to make fitness, those things we can really take care of on an individual level, fitness, nutrition. We want to hone that in and really start advocating for that being the ground floor of healthcare, so we can move away from some of these chronic issues that are there simply because we don't have those first 2 things honed in. So what are some of the things that you've seen through your career, you believe right now that needs adjusting or changing in the healthcare field? You can go any direction you want with this, but what are some of those things that you've seen you'd like to see change?
That's a very good question, and one that needs to be asked across our country to figure out, how do we move forward and how do we get better at what we do from a system standpoint. And I guess the thing that I've been most impressed with lately is, it's really important in healthcare that what we do is based on evidence. Mm-hmm. And at the same time, if you look at any well-designed study, it's going to have a very well-defined population a group of people that are in some ways homogenous, so that you can say at the end that either this intervention did or did not have a significant effect on people that are like this. And then we as clinicians have the challenge of applying that, especially in neurology. We have the challenge of applying that to people who may be the similar, but not the same, not exactly like that person. So it has to still come back to a patient-centered approach, something that is more individualized for the patient. And so as therapists, we always have to customize what we do based on what we see in that individual patient. From a healthcare system standpoint, I think that getting back to grassroots is going to be at least a part of that. And I've been really impressed with just in the past 4 or 5 years, and you're a part of this too, seeing people that are making a commitment. Oh, that's wonderful.
It's okay.
However you want to do that. Let me just hang up on them.
Okay, you're fine. I'll do that. Stop record. Damn, just keep letting it go.
Yeah.
What if I
You've reached the Phelps resident. Sorry that we can't take your call right now, but if you leave your name, number.
He ended on. We can start back on grassroots.
Yeah, I can find a CD.
So where should I start back now?
I think the grassroots, I think, is what from a healthcare system standpoint.
Okay.
You were saying what we were doing well.
Okay.
We'll talk about that all day long.
So from a healthcare system standpoint, it's really important that we get back to a grassroots level. And so you and your clinic there in Birmingham and others that I know of, people who have an idea of getting back into the community and doing something that's more directly related to people that you're right around. So the bigger a healthcare system gets, the harder it is to keep it customized like that. And the more difficulty it has to keep things working smoothly and flowing in the right direction. So I'm very happy to see more PT-owned community private practice PT clinics that are operating really around the whole country, and a lot of new entrepreneurs like yourself who are looking at, how does my calling in life fit with what this community needs? How can I bridge gaps, between PT, but also fitness and eating healthfully and every aspect of nutrition. So put all that together, and those kind of fresh ideas for how to get things done from a business standpoint, but also from a patient care standpoint. And if that happens within a healthcare system, I think everybody benefits from it. I think the healthcare workers benefit by providing in that environment, and certainly the patients benefit because of that personalized, patient-centered care that is directly targeted and customized for what they need.
Right.
Amen.
Right. Would you say that fitness and nutrition, would you call that healthcare? Do you hope it is healthcare in the future? Like, what is your perspective on that? And in terms of, I guess, the importance as it relates to the brain, physical therapy, all of that?
Oh, for sure. I mean, especially, it goes all the way back to pediatrics. So in human development, I have a brand new grandson who's just a month old now, and to see him changing, week by week, and how things change. And if he weren't getting good nutrition, that development is going to be impacted to the point that his motor behavior and cognitive behavior is going to be impacted for the rest of his life.
Right.
So it starts all the way back there, but then it has to drive every healthy person in the way that they live their life. And certainly it has to drive recovery after neurologic injury. So, it's something that we emphasize in the PT curriculum at the University of South Alabama, that you have to have that nutritional support, and it's something that we need to screen. And if we find out that there's a problem there, then we need to refer that to individuals like nutritionists and dietitians that can help to fill that gap and give some real concrete strategies that the person can do to improve their nutrition. So it's definitely a key part of being healthy and fit.
Yeah, that's a good perspective, even all the way back to early development. It's cool because I mean, when I meet people, I only meet them at the state they are then, and you have to think about so many other factors that are playing into their health, even from their development stages. Yeah. And so it's just fascinating.
Totally. Yeah. So what would you say are some things in healthcare that we're doing well right now?
Okay, I'll give you a little personal perspective here. You know that my wife had colon cancer for 5 years and died 2 years ago. But going through that process, we felt very cared for by the healthcare system that we were in.
Amen.
Everything from the nurses to the oncologists to the oncologic surgeons, the people in the hospitals, on the wards, everybody. So that was definitely a positive. But there was still, and both of us are well educated. Both of us had PT degrees. And there were still times where, even with all that, we felt ill-equipped to make some of the decisions that we had to make. And some things that were told to us that we didn't really grasp the full impact of what it meant. So it's a positive, though, that I think in general, healthcare workers do a really good job of really caring for patients. Now, that's certainly not 100%, but most people in healthcare make the person feel that they're cared for, which has to be there. That's an important part of recovery from anything. And then the other part of it is that I think the other thing that we are doing well is that there is a lot of research that's being developed, both from a medical standpoint and from a rehab standpoint, to understand what is the best way to test things, what are the best outcome measures to use, what are the most appropriate interventions that we can provide for individuals with a certain constellation of things that we found on the examination. So I think that as a basis for developing new knowledge and then implementing that in the clinical setting is very, very important. And I think that the healthcare system in general is doing a good job there. I would just carry that a little further and say the thing that we need to do more of now is translation of that research into the clinical setting. So I know professional organizations around the country are working to try to find ways to get that most important research information into a form that can easily be applied and understood in the clinical setting. So those are the two things that I think, from my own experience as the spouse of a patient, and also for myself at just observing physical therapy, that I think the systems are doing well. Still room for growth always, right? Because there's always something that we can do to improve.
Right.
That's great. That's good insight.
Well, we're so grateful for the time that you've given us to be on this podcast. And we close the podcast with the same 3 questions, or not the same 3 questions every time. We kind of tailor it to the individual. So it's similar, same concept. But we do want to ask you, what is the best habit that you are currently doing that's having the biggest impact on your life, so specifically your health in any domain of health?
Okay. I think that being intentional with my plans and related to my purpose in life and kind of keeping that at the forefront of my mind. And that includes, decisions about my health. In the past couple of years, I've been much better finally at being physically active and, riding bike or riding a stationary bike. Even just in the past couple of months, I've started to do some yoga, especially for some stretching and to keep myself from getting tight. So just not letting that just happen, but being intentional about planning, looking at where I am now and looking at what I want to change. And that really applies to every aspect of our lives. So I would say that my best habit is just being intentional and planning for the future. And that includes like my finances too. I think Noelle and I were very intentional with our finances over our whole marriage. And so I think that's very important.
Yeah.
Love it. Great.
Okay. Second question. What are you reading right now?
Okay. I guess my most consistent read right now is the Bible. It's something that, gives us hope in difficult times. It gives us answers when we only have problems. So that would be my most consistent read. But the thing that I've been specifically looking at lately is a book that I revisited after a couple of years by Elizabeth Elliot. It's called The Path of Loneliness, which emphasizes not just the bad parts of being alone, but what's the good that comes from that, and how can it be used to strengthen your life. And she speaks from her own experience of her husband, actually several husbands over her lifetime that died before she did, and how she dealt with that. So.
Wow. I've actually never heard of that book, but I know Elizabeth Elliot. I've heard of her. I've read a lot of her other books, so I'll have to look at that one.
That's good. Cool.
Do you have one quote we can end on? A favorite quote? It can be a Bible verse.
I would have to go back to the scripture again, and in Jeremiah it says, "For I know the plans that I have for you, and they're plans for a hope and for a future." So back to the fact that regardless of what's going on in our lives, there's always a hope for the future.
I love it.
That's so
That's
good.
a great way to end.
So good. Dr. Fell, thank you so much. I'm going to hit the stop recording button, but thank you so much. I appreciate you being on the episode.
You are very welcome. My pleasure.
Thank you. I'm going to end it. Ooh.